how do we monitor the babies? We have already made a list of things which we use for monitoring, but now we go one after the other. What is the importance of these things? So antepartum fetal surveillance is a major question for you. Each component like NST or CTG, then biophysical profile, amniotic fluid index, these things separately can come as short note questions also. And the biochemical monitoring methods are no longer used, and we usually go for biophysical methods. The first one is daily fetal movement count, then heart rate reactions, fetal activity, Likert volume, and the blood flow studies. So coming to daily fetal movement count, it's a cost-effective one and it is a universal screening procedure. You can tell everyone in any country, any place, you can just ask the mother to count the number of times the baby moves inside. 70 to 80% of the movements are perceived by the mother. Again, you should be understanding this concept that not all the movements of the baby are picked up by the mother. About 70 to 80% of the movements could be picked up, and especially the low risk ANCs, the antenatal women with no risk factor, but still we call them low risk for obvious reasons. And these mothers, this could be the only advocated method of surveillance. You need not do any other test. You can be assured if the movements of the baby are adequate and satisfactory. Obesity, polyhydramnios, oligohydramnios can adversely or favorably affect the perception of these movements, and the evidences say average 31 movements occur per minute, but you are not going to really feel all those 31 movements, but the baby moves almost 31 on an average per minute, and baby also has a sleep cycle of about 90 minutes. Okay, so if you don't have fetal movements for over 90 minutes, probably you are sure that baby must be asleep. Just wait for some more time, you may start appreciating the movements of the baby. That is the reason why even NST is recorded to a maximum of 90 minutes with an idea that we may see some movements, we may see some accelerations if we really wait for that 90 minutes to go beyond the sleep cycle of the baby, right? You have something called Cardiff count devised by the hospital in Cardiff, 10 movements in 12 hours. The woman is asked to count for 12 hours, and if she has got 10 movements in the 12 hour, 2 to 3 movements per hour also. The other way is 2 to 3 movements per hour. It is reassuring. So she fixes a time morning 8 to evening 8, and if she feels about 10 movements, that means she is having a baby which is reasonably doing well in utero. Again, in 1 hour, if she is feeling 2 to 3 movements, of course, in between 1.5 to 2 hours, there may not be any movements also. That is because of the sleep cycle of the baby, right? The 0 to 3 movements in 12 hours. In the whole of 12 hours, no movements or maximum of 3 movements is ominous. So it is also called movement alarm signal. So this is how you ask the mother to monitor, and on a daily basis she can do it, and that could be instructed as a warning sign. If the movements come down, she has to immediately meet the gynecologist. The other test that is done, more objective. See, DFMC is a subjective test. This is an objective test. It's a documentary evidence, right? So it's called non-stress test NST, or also known as Cardiotocogram. Here the cardiac cycle of the baby and also the uterine activity is recorded. So it is called cardio and toco. Toco is the uterine activity records. So Cardiotocogram. So it is either called CTG or it is called NST. So it is a graphical record of fetal heart rate. Relation to the uterine contraction also is recorded, and you have a provision to mark the fetal movements.